Hi, this is Melissa with Medical English Melissa, and this is Medical English 5-Minute Clinic. This is a 5-minute lesson where I go over helpful medical phrases and terms for you to use in your clinical practice. To cut back on, to cut down on, to cut out, to quit cold turkey, to increase your intake of, to get more exercise, to lose weight, to change your diet. So what do all these phrases have in common? These are the phrases that I have found that my students have the most trouble with when we're working on how to educate a patient on something in English. I'll be focusing on diet and exercise. We'll see how much I can fit into 5 minutes. I'm probably going to go over. So first, I want to talk about how we make recommendations for patients. So when you want to say that you recommend someone does something, you can say, I would recommend that you get more exercise. You could really benefit from getting more exercise. It would be a good idea for you to get more exercise. You should consider getting more exercise. You should consider trying to get more exercise. And this is how you would say the most basic sentence with recommendations in English. So when I'm doing mock interactions with my students, this is often where I see mistakes made. So keep this in mind. Quick interruption to say that I am starting a waitlist for a medical English class. So if you're interested in joining the class, you can go to my website up here. Well, this doesn't work as a link, but that's the website. You can find the link below and get on the waitlist, and I will let you know when the class is ready. Okay, let's get back to it. So first, to get more exercise. It's recommended that you get more exercise. I would recommend that you get more exercise. Really important to point out here that when speaking, you can say to get as the verb and exercise. In English, you can't say to make exercise or to do exercise. You can only say to get exercise. The only time that you can say do exercise is when you're doing specific exercises. Let's talk about diet. So there are two different ways that you can talk about diet. You can say to go on a diet, and you can say to modify or change your diet, and they're not the same thing. So when you say to go on a diet, that means to restrict what you're eating in some way in order to, usually to lose weight, but in order to change yourself in some way. So that's to go on a diet. But to change your diet doesn't necessarily mean that you're restricting what you're eating in some way in order to lose weight or something. It can just be to increase something good in your diet, right? So you can change your diet to include more fruits and vegetables. You can change your diet to include more omega-3 fatty acids, right? There's things that you can do to change your diet and things that are good for you that aren't necessarily calorie restriction or even restricting any food. So usually when we're talking to patients, we're asking them to change their diet and not to go on a diet. Which brings me to the next thing that I want to talk about. So this is probably the most common mistake that I see when we're talking about this sort of thing. To lose weight. So for example, how much weight have you gained in the past year? It doesn't need an article or a pronoun on it. You could just skip that most of the time and just use weight. So talking to a patient about weight loss. This is a touchy subject, as we say, a delicate subject, and so we need to be really careful how we discuss it with a patient. First, I want to give my own opinion here and say that I think that we talk about this too often in medicine. I think that oftentimes it's not actually someone's weight that's the issue, and we can cause a lot more harm than good when we tell a patient to lose weight. It can make them feel ashamed and maybe even avoid visits with you in the future, and it doesn't usually even get them to change their behavior. So instead, we could talk about healthy lifestyle changes. So including more veggies in their diet, getting more exercise, and so let's talk about the words you need for these. Before I go any further, I want to ask you to please, if you haven't already, subscribe to the channel and share this video with friends. It's the most helpful thing you can do to support me so that I can continue making free lessons on YouTube for you. Changes to diet. So there are a ton of phrasal verbs here, a lot of them with the word cut. So to cut out is to remove something completely. So To cut something out of your diet would be to remove it completely from your diet. So if you found out that you had celiac disease, you would cut out gluten from your diet. There's cut back on. Chances are, if you're listening to this, just like me, you need to cut back on sugar. So to cut back on sugar, to reduce the amount of sugar in your diet. Cut down on is another way to say to reduce the amount of something. So here's a fun one. So I tend to stay away from idioms because there's so many that if you try and learn them all, it's just not happening. But here's one that you will want to know. To quit cold turkey. So this makes no sense. It has nothing to do with the turkey and it's not cold. But it just means to stop something suddenly and completely. So you'll hear people use this when they talk about cigarettes. They'll say, are you going to try and wean yourself off? Are you going to try to cut back slowly? Or are you going to quit cold turkey? So to quit cold turkey. Now, what do you say if you want someone to eat more of something? Well, you can say, eat more whatever, eat more veggies. I recommend that you eat more veggies. But you can also say, increase your intake of. You should increase your intake of omega-3 fatty acids for brain health. And a bonus one, because someone commented that they specialize in sleep disorders. When we talk about sleep, we talk about sleep hygiene. Not all patients might know that term. You can also just say bedtime habits and sleep hygiene. So that's things like, do you sleep with your phone right by your bed? Are you staring at a screen until you fall asleep? Do you have caffeine too late at night? Are you drinking alcohol right before you go to sleep? So these are all things that we call sleep hygiene when we're talking to other medical professionals. And we can say that with patients, or sometimes we just say bedtime habits and sleeping habits. And that's all I can fit in for today. Thank you so much for joining me. Once again, you can find me in all of these places right here. I'm on social media all the time, probably too much. You can message me on my website up here if you are interested in getting on the wait list for my medical English class. And I will see you in next week's episode of Medical English 5-Minute Clinic.